So Dr. Willard, we just to give you an update and the rest of our team an update, we have had a crazy marathon run. We definitely have so far underestimated for weather. Sure. Screening, and we had a listener call in and actually ask us a question, and maybe you can delve into this question too. But her father had colon cancer. And she was wondering, because her father had colon cancer at 61, when should they get PSA screening for prostate cancer?
So I think this may answer the caller's question from earlier. So what are the new guidelines? Basically, when to test for PSA. So men that are 85 to 70 that are healthy should be tested. Guys over 70 years of age with a life expectancy should be tested. Guys that are between 45 and 49 with their initial PSA test, if the PSA is less than 0.7 nanograms per mil, retesting should be done at age 50.
Dr. Cabusi is not even say he's a colleague, I would say he's a very good friend of ours. Thank you so much for joining us. And tell us, what are you going to be talking about today?
So I'm primarily going to be talking about robot-assisted vasectomy reversal. And first of all, it's great to see you, and I'm thrilled that you guys are doing the Drive for Men's Health. So thank you. You know, no surgeon likes to think that he has a tremor, but when we're talking about really microsurgical surgery, we probably all have a little bit of a tremor. It's debatable on each surgeon whether that's affecting their surgical outcomes, but the robot has zero tremor, so it takes that out of the equation completely. So there is.
But Dr. Lee is going to spend some time talking about metabolic syndrome and LUTS, and is there a connection between the two? So Dr. Lee, would love to hear from you now. Thank you so much for joining us today.
Terrific. I appreciate the opportunity to speak. Now, I'm going to talk about sort of what I think is an exciting new topic in my area. Basically, the concept of whether external factors other than just a big prostate or an overactive bladder may lead someone to have a lot of urinary symptoms. So you can see that the prevalence of a higher AUA symptom index seemed to be directly correlated with an increase in the metabolic syndrome.